All right, all right. Can everyone see my screen? I'm working with two different screens. Everyone can see the presentation?
Yes.
I got some thumbs up and yes. Awesome. All right. Well, again, welcome everyone to today's Behavioral Health Advisory Group meeting. I'm going to officially hand it over to our co-chair, Margaret Fowler, who will give us our official welcome and do our icebreaker as well. Margaret?
Okay. Thank you, Shanae. I'd just like to welcome everyone today. And as normal, what we normally ask everybody to do is just type your name and the organization in the chat and letting you know that the meeting is being recorded. So if you do not want to have your beautiful faces and handsome faces on the recording, you are allowed to shut them off. We also just wanted to give an opportunity to anyone, it's the first time that you've been here to the meeting, that maybe you want to just come off. We don't need to if you don't want to come off, but at least basically introduce yourself. And then if not, if you don't feel comfortable doing that, again, you can just put it in the chat. And then the icebreaker that we are asking people to think about is, how are you staying active during Walktober? And as Shanae was saying, it's such a beautiful day out today. It is perfect weather. So I don't know. I can tell you, I'll start us off by saying I've just been going out for a walk and just taking nice deep breaths. And, even when it was raining, it was still okay. But today is just a phenomenal day. So hopefully if you get a chance, go out and just enjoy the sunshine. So that's what I'm doing. I'm just walking these days. So anybody else want to share?
I can share. So I started in September, but I'm continuing through October. But I've been walking 3 miles a day, 6 days a week. And now that we are officially in October, I was like, oh, let's make this fun. And so every time I go out, I find at least one sign of autumn. So if it's like the leaves changing colors, or maybe there's some leaves on the ground, where the sky looks a little different. I take a picture every day just to see the progression of how autumn is coming into its season. It's very pretty.
Especially when you see something of that bright red, all of a sudden you go out and then it's that bright red. It's so pretty.
Yes.
Yeah.
In fact, the leaf I took a picture of yesterday was a bright red leaf. It was the only red leaf on the tree. And I was like, oh, that's a good one.
Yeah, that's very pretty when that happens.
Anyone else care to share?
I see people are putting hiking, so that's a little bit like walking, but a little more strenuous.
That's a good one. A lot of hikers. I need to get with you all.
Yeah.
Lisa says yoga. That's a good one. Sounds like a very peaceful exercise.
Oh,
Alex,
I
hiking
like,
with my dog.
yeah.
It's a good one. I love it. Larry, walking on college campuses to feel like 18 again. Yes, the homecoming was this past weekend. So yes, I'm with you on that one. Good times, good times. Awesome. Maybe one more person wants to share, and you can type in the chat or you can speak out. It's okay.
Well, I just want to say with Larry, I don't know if he feels the same way, but as you see people, as the college kids are getting older, I don't feel that way because I'm just staying still. So everybody else is getting older around me. That's why I like to go watch on campus. I'm like, hey, they don't look that much older.
Good. Awesome. Okay. Let's go ahead and move on with our review of the agenda for today. So now that we've had our welcome and introductions, I do just want to go over briefly how this meeting will go. Up next, we will have our BHAG Partners in Focus, where we put into focus various partners of our BHAG who will share a little bit about their organization, some of the work that they do, and potentially some ways that we can best engage and support them. Following that, sorry, I'm admitting some people. We will have our main presentation with Lisa Patillo-Crawley, who will share about Maryland wellness. And then I have just a quick update regarding our community health improvement plan, some community announcements to share, and then we will adjourn for the day. So lots of great information to come. So sit back, relax, and enjoy. All right. So I'm going to introduce our first partner in focus, Ms. Shanita Newman. And I'll just go kind of briefly through her bio, but she's a licensed clinical professional counselor and Maryland Board Approved Supervisor dedicated to helping individuals, families, and emerging clinicians heal and grow through compassionate, mindful care. She's the founder of Mindful Therapy. She provides warm, collaborative spaces where clients can explore their stories, build emotional resilience, and reconnect with themselves. She utilizes a therapeutic approach which integrates mindfulness, expressive arts, which is awesome, and trauma-informed practices to support clients navigating anxiety, depression, relationship challenges, life transitions, and generational healing. She's especially passionate about increasing access to quality mental health care within Black communities and helping clients understand how past experience shape their present. She also provides clinical supervision and mentorship to new therapists, guiding them in developing both their professional identities and their authentic clinical voice. Shanita's work is a belief that healing begins with self-awareness, compassion, and the courage to do the inner work. So Shanita, we welcome you. I'm going to stop sharing my screen so you can share yours, and we look forward to hearing about your organization.
Awesome. Well, thank you again for having me. Again, I'm Shanita Newman, licensed clinical professional counselor in Maryland, like you guys just heard, board approved supervisor. I provide individual and family and group therapy to both adolescents, adults, and their families. I specialize in working in trauma informed care, responsive and strength-based care as a clinician. I focus on a lot on making mental health as accessible as possible to as many underserved communities as possible. I'm located in Lanham, Maryland, but I do virtually service clients throughout the state of Maryland. But my actual office is in Lanham. So some of the services that I do provide as a clinician is again individual therapy for youth and adults, family and support sessions. So not necessarily family therapy, but when you work with youth, you automatically work with families. So I do provide support to their families and caregivers, clinical supervision, as well as workshops and trainings and community partnerships. The populations I serve is mainly adolescents. I used to work with the younger kiddos, but mainly adolescents 13 to 18, that young adult college age, and adults 18 plus. I didn't add it to the slide, but I am on the referral list for UMD. So I do see some of their college students who are either in coming to UMD for like the school year or they actually live in our residents of Maryland. Also servicing Black and Brown communities, professionals who are navigating burnout, a lot of our community members who are experiencing furlough at the time, work life stressors, survivors of trauma, grief, and relational challenges. So, some of my areas of focus with working with those communities and those populations is anxiety, depression, adjustment concerns, trauma, racial stressors, identity, self esteem, setting boundaries, relationships, lots of emotional regulation, as well as access to care and reducing the stigma around coming to and receiving mental health therapy, especially in Black and Brown communities. So opportunities for engagement with mindful therapy looks like community outreach and education, as well as access to care initiatives. So partner on workshops, mental health awareness events throughout the county and throughout the state. Access to care initiatives look like collaborating initiatives to reduce the barriers to access therapy. So sometimes clients do not have, I come across clients who don't have therapy, so they're paying out of pocket, and it's my job, or I try to make it my job to support them in finding ways to help them pay for and continue to come to therapy, as well as implementing practices in my practice to make it more accessible. Training and professional development. So offering trauma-informed training to organizations, as well as supervision opportunities for future clinicians, and as well as workforce development to support local clinicians, because it is hard to kind of get your footing in this field sometimes without the proper support. Youth and family support programs, so developing programs that can support our youth and support their families, because if we support their families, then we ultimately do support the children as well as research and advocacy. So continuing to contribute to data collection, community needs, figuring out best ways to show up and be an active member in the community. So ways for BHAG to support mindful can look like referral pathways, program collaboration, funding resources and support through grant opportunities, partnering to create and develop new programming, as well as connecting clients to culturally responsive therapists. Policy and advocacy collaboration, workforce development, so training clinicians who are culturally aware and trauma informed to continue to go out into the community to support the community as needed. The ways that mindful therapy can show up and support BHAG can look like using my clinical expertise as well as expertise of future clinicians that I will bring on, training and mentorship, community engagement, as well as continued research and evaluation, advocacy for around policy, staff wellness, so that the people who are doing the work and supporting those who are doing the work can keep on being in the field and being in the community. And that is everything for the slide. I thought I was trying to click through one more because I must have accidentally deleted, but it was a contact. But I know you guys do have the contact information for me, but just more ways to contact me. So in a very short time, that is all I have for me and for mindful therapy. Thank you again, guys, for having me.
Thank you, Shanita. That was great. And as you are putting on events or looking for engagement, please feel free to just you can send it to me personally. You can send it to the coalition's email address. Either one is fine. I access both, and then I can share them out with our BHAG work group members. I can share them out with the larger coalition if you're looking for partnerships across some of our other work groups. I'd be happy to share those with you as well. Or if you want to connect with any individual work group member, we can make sure that that connection is set up for you. So thank you so much for sharing. Any questions for Shanita? You're welcome.
I'm sorry, hi.
Yeah.
Are you accepting private insurances?
I am. So I currently am accepting CareFirst, United Healthcare, and Cigna. I'm also partnered with Headway and Sondermine. So I'm accepting even more insurances through those platforms. So I know I can't remember all of them off the top of my head because it is a lot of them through those platforms. But with Sondermine, I know I work a lot with people who have Kaiser as their insurance. That's a big one that comes through Sondermine for me. And then with Headway, a big one that comes through who I'm not individually credentialed with is Aetna.
Thank you.
Dr. Blunt, did you have a question?
Yes, I was going to ask the same question. Is she on insurance panels? And do you accept public insurance, Maryland Medicaid at all?
Not Maryland, not directly, no, but if they go through the state and then end up getting like private through the state. So I have some clients who have CareFirst, but they have CareFirst through the state.
Okay. Okay, thank you.
Any other questions? Okay. Shanita, if there were additional ways that we could contact you, just go ahead and email that to me and I'll make sure it goes out with our follow-up email. I send that out usually by noon tomorrow.
Okay, sounds good. Thank you.
Yeah, you're welcome. Awesome. All right, I'm going to move on to our next presenters. We have a tag team here. Our friends from Shepherd Pratt, Mr. Russell Clay Robina and Jennifer Carberry. Just their brief bios. Russell is a clinic director for Shepherd Pratt in Lanham. He graduated from Southern Connecticut State University in New Haven, Connecticut with an MS in clinical mental health counseling. He has 5 years postmaster's experience in mental health counseling, solution-focused approaches, CBT, and mindfulness, crisis management, and therapeutic crisis interventions. So thank you, Russell, for being here with us. And then we have, Lord Jesus, take it, Jesus. Okay, we have Jennifer, who is the Director of Operations for Community Treatment for Shepherd Pratt. In her role, she oversees the outpatient mental health centers across the state of Maryland. She received her bachelor's degree in psychology from Ithaca College and her master's in social work from the State University of New York at Stony Brook. She has 25 years of postmaster's experience working with children, family, and individuals, including individuals with serious mental illness and co-occurring disorders. Practice areas for Ms. Jennifer include assessment, advocacy, crisis intervention, clinical supervision, quality assurance, outcome measurement, program development, and program management. So let's welcome Russell and Jennifer with us today.
Thank you so much for having us. And let's see how well I did in presenting in teams. Something's happening. Yay. Okay. All right. Thank you. So thank you for having us. We are here from Shepherd Pratt. That is a large provider across the state. And so we are one of the largest private nonprofit providers of psychiatric services, as well as the largest provider of non-public special education schools in Maryland. We serve clients from 39 states and 15 countries. We have more than 380 sites of service across Maryland and more than 160 programs. The hospital, we have 2 hospitals. One is in Towson, the other one is the Baltimore, Washington hospital, which is fairly newer. And there's about 5,000 employees across the state. Our mission is to improve the quality of life of individuals and families by compassionately serving their mental health, addiction, special education, and community support needs. We are so pleased to be in Prince George's County. I'm not sure if it's a full screen or you're seeing all the slides on the bottom, but if it's not distracting for you, I'll just keep going. Sorry, the technology may not be perfect. But we're so glad to be in Prince George's County. We've had school-based mental health services in Prince George's County now for about 7 years through a competitive grant process through the Transforming Neighborhoods Initiative, TNI, which was spearheaded by the county executive. And the program started as a Medicaid fee-for-service program in just 4 schools. And that has grown, I think, to 32 schools, but we may be bigger than that, maybe 40 schools at this time. And that just represents the need in the county for children's mental health services that we were able to expand into these other schools. And so the school-based clinicians are embedded in schools for kids, which is the best to be able to get your mental health treatment within your familiar environment. And so we really hope that most of our kids can be served in schools with therapy and never really set foot into an outpatient mental health center. But we do know that we have kids who also have medication management needs, and there is really a seamless referral process to child and adolescent psychiatric providers once you are a client in one of these schools. And so they do a tremendous amount of work in the schools to support our kids, and that's individual and family therapy, different support groups, consultation to the child study teams, of course, medication referrals, which I'll be talking more about today, referral for case management and social support services. They also do classroom observations and teacher consultation. None of this would be possible without the grant because these are not billable activities in Maryland. And so we're just really pleased to be part of this program in the schools. Of course, we also do suicide risk assessment, workshops for parents and teachers on mental health topics, and work to evaluate and assess any child's needs for a level of care. And of course, very popular case management services and parent engagement services. And so, piggybacking off the great work that has been happening in schools for a number of years, we are finally able to launch our new clinic services in Lanham. And so Russell Claver Obina is the clinic director in Lanham. So I'll give him the opportunity to talk about this new beautiful site.
Good afternoon, everybody. I am Russell. In regards to the site, we are located at 7401 4th Boulevard in Lanham. It's a newly opened outpatient mental health center. We have a lobby area. We have spaces for groups, 2 spaces for groups. We have shared space with caseworkers from the PG school system that offer services like Jennifer said in the school system, as well as, let's see, let's go to the next one. You go to the next slide.
Sure can. I just do want to say that this would not have been possible without a SAMHSA grant to open the new location. And so we were very pleased to be awarded an operational grant to get this off the ground. It's hard to finance some of these services, and so grants and contracts always really help us. And so the next slide, Russell.
Okay, so we offer inpatient and telehealth services for clients. We have a child and adolescent provider as well as adult providers for injections and psychiatric care. Once again, we offer therapeutic services in person as well as telehealth to meet the client's needs and meet them where they're at. We also work and collaborate with our psychiatric rehabilitation program as well as the residential rehabilitation program. So we offer support and health as well to health and well-being, improve quality of life, reduce symptoms and needs, build resilience, restore and or improve functioning and support integration into the community. We support and manage several clients with priority population diagnoses, so such as major depression, psychosis, delusions, as well as bipolar. So along with those are some of the services that we provide for those clients and how we meet their needs.
Thank you. So that's just a picture of our flyer for our new OMHC, and we do support people in all of their mental health needs for children beginning at age 5 and throughout the lifespan. I would say that one of the things that may be a little different about some other providers is there's really an expertise around this persistent mental illness. So folks on the schizophrenia spectrum, we have a day program that people come and have breakfast and lunch and participate in therapeutic groups. That's our psych rehab program. And we also have residential rehab. So folks who need housing and maybe 24-hour support, activities of daily living, medication monitoring. And so we integrate our clinical services for that population, but also do serve adults with depression, anxiety. But it is the persistent mental illness that is maybe a little different than some of other providers. So we would be a good referral source for folks, maybe transitional age youth, kids that have been identified, as the other presenter was saying, through a college. If they've had their first episode of psychosis, it may be great referral because we have a child and adolescent doctor and an adult MD who really do specialize in psychosis as well.
I just wanted to add in also vocational support. We do work with helping them get reintegrated with work if they're looking for work, as well as any additional goals they may have in the community, whether it's volunteering or whether it's meeting additional needs that they would like for themselves.
So the overall goal, we also have integrated substance use treatment. And so the overall goal of the community treatment programs is to provide integrated care, whole person wellness. And so it is a single point of access. If you access our mental health services and we assess that you also have a co-occurring disorder, a substance use disorder, it is integrated. So it's not like you have to go to another program. You've already been enrolled, and we just assign you a substance use counselor, and we have some robust groups. And so it's all within the same program so that it can be coordinated and less of a barrier to folks, as the access to care is very important. We want to be ready when folks are ready to initiate care. So we want to help people develop their own path to recovery. We do work with the recovery model and wellness recovery action plans. We do want to help folks develop emotional and behavioral competencies that foster that successful relationships, and identify their own unique strengths and resiliency, as well as identify unmet needs and preferences, experiences in life, trauma. I know Russell just completed the trauma-focused CBT training as well, and we do like to work with EBPs. So a lot of the work we do is with motivational interviewing and a CBT, a trauma-focused CBT, as well as what I really love is CPT, cognitive processing therapy as well, that came out of the VA. So we do use our evidence-based practices in all the work that we do. We want to help, as Russell said, maximize their achievements in school and work, and have insight developed so that they can continue to excel in their life goals. What to expect for a referral is registration is conducted by a simple DocuSign process. And the first appointment is scheduled as a diagnostic evaluation with a qualified mental health provider or a substance use counselor, depending on what you checked on your intake package, that you're seeking mental health treatment or you're seeking substance use disorder treatment. Sometimes those doors, it depends on what door you walk into, then you kind of get siloed in those doors in the history of our work. This is an integrated assessment and easy referral between the two, as we know that both impact each other in the one body. So we also, of course, do individual treatment planning based on their strengths, needs, abilities, and preferences. We do psychiatric evaluation with med management. We also do have an injection clinic. So if you are on a long-acting injectable, your needs can be served right there in Lanham. As well as I mentioned, our providers are very well versed in psychosis, and so we do initiate clozapine, Clozaril, in the community, which is an asset when we have folks who have unmanaged psychosis and have been on a number of other medications that have just not been effective. Clozaril is one of those medications that sometimes can be tricky to initiate, need blood work and labs to ensure good health while we initiate that. Of course, we do weekly individual, group, or family therapy as indicated, and we do offer good referral services and coordination with our school-based programs, with our psych rehab programs, primary care, residential crisis, and case management services. So we hope to be a one-stop shop. Once you walk in with us, we're going to try to take care of all of your needs. We do have a centralized intake phone number. And so no matter where you are in the state, you call that number and we initiate care through our DocuSign process. It comes to your email, do a couple of clicks, and we are able to enroll you in the closest clinic to your home location. I know a lot of us, when telehealth came out, we started serving people all across the state. And but location does count for us because we do want to see you in person. We do want to be available if you do have injection needs. And As much as our clients do not want to come back into the office for many reasons, about 70% of our services are telehealth, about 30% in person. We are ready for our clients to come back in person if they choose to do so. But of course, I respect telehealth. It's much easier for a parent of 3 kids to hop on a 45-minute call from the comfort of their home and not take the bus or spend their gas money and all these other things to get in person. But sometimes there are reasons that we want to see you in person for the medical part of that, particularly around your vitals and AIMS, if you're familiar with AIMS, abnormal involuntary movement scales. If you are on any antipsychotics, that is an important assessment that is hard to do from the head up. We'd like to see you in person. So these are just additional services that are across the state. And mental health services are for aged 5 and above, and the substance use currently is 18 and above, so they would be adults if they had substance use needs. They do offer outpatient. They do offer IOP, intensive outpatient, in some of these locations for the substance use. And the one in Rosedale is substance use only. For the rest are full OMHCs. And then I just did want to shout out a resource that Shepherd Pratt has. It is psychiatric urgent care. And that is, I think, a phenomenal service that Shepherd does. I do not oversee that program, but I share it with everyone because you are able to walk into one of these locations at Towson or Baltimore, Washington campus and have an immediate psychiatric triage. And so that is, you come in, do the psychiatric evaluation with a nurse practitioner or an MD, and they assess levels of care. If you need inpatient and there's a bed available, it is pretty much right in because you're able to be admitted through that evaluation process, or a psychiatric partial hospital program. If you needed a PHP, you could also walk in through psych urgent care and be evaluated for inpatient PHP or outpatient level of care. You'd have to be 5 years of age or older for the psych urgent care. Be voluntary. You have to be a willing participant in a voluntary evaluation. There is no involuntary through psych urgent care, no EP through psych urgent care. Be medically stable, not be under the influence of alcohol or substances at the time of your evaluation, and not deemed to be physically aggressive, agitated, or dangerous at that time. And so I just want to just let you know that they have that service for anybody across the state. And that is the end of my slides. But I am open to any questions that you might have, and I thank you for your time.
Thank you, Jennifer. We have about 2 to 3 minutes for any questions. Looks like Jay has her virtual hand raised.
I help run part of the homeless service system here in Prince George's County, and I'm wondering, you mentioned people who are not managed at this time, and you also mentioned the fact that, you know, certain parts of it are voluntary. Can you talk a little bit about working with people who are not entirely sure that they're ready for treatment at this moment?
Sure. I don't sell anybody on a lifetime of therapy. It's an assessment. Are you willing to have the assessment? Because that's where we start the engagement and rapport and make the assessment about what services that you would perhaps benefit from. And so when working with clients who are ambivalent about, do I need mental health treatment or not? I try to just say, hey, it's an hour of your time. Let's benefit from the assessment and go from there. Because it's hard to make a commitment. Oh my God, a week in therapy, I can't. No, we're just coming for the assessment and see what they can do. And then hopefully during that assessment, it's a good connection, a good rapport, that we've offered some intervention even within the assessment, that you're willing to come back for further treatment. I should note that we are only accepting Medicaid currently in the outpatient services in Lanham. But certainly we work with a lot of folks who are homeless, ambivalent to treatment, maybe not sure about taking meds yet either. And so we do shared decision making, right? Because it could be scary. So you're going to go do a psychiatric evaluation with the medical doctor. Well, I don't want meds. Okay, well, we just come for the assessment. And then you come back to see the doctor again and relationship building. And then perhaps through that, you gain some insight or willing to try a medication. And perhaps I'm speaking a little bit more around psychosis, but it's really any medication that we want to stay with you. And so your appointment with a doctor doesn't have to be just for meds. We don't like to call them prescribers because they do much more than prescribing medication. It is a relationship building, shared decision making, and hopefully you buy what we're selling and try that a little bit of Abilify or Invega because it could change your life. So thank you for your question.
Thanks.
Thank you. And we'll take this last question from Mr. Corey. And then if anyone has any follow-up questions, I'll be sure to share your contact information, Jennifer, as well as yours, Russell, and they can follow up with you directly. So Corey.
Thank you so much. And it's great presentation as well. I was looking at the psychiatric urgent care, but I wanted to check in with, I'm sorry, I'm from the local behavioral health authority here for Prince George's County. And so I wanted to talk about if you guys interface, clients that are uninsured, especially if they're from Prince George's County, just so you know that you're able to provide that service, and I will be the contact in terms of processing those benefits for them in our county. So I just want to let you know if they are people that are coming to seek outpatient services and they're uninsured, that there is still that connection there, especially for Prince George's County residents.
Good, great question. Our national landscape is, we're all sitting on pins and needles about what's going to happen with Medicaid and the work requirements and the Affordable Care Act. But currently, if the person does not have insurance, but they're eligible for Medicaid, that we would be able to do the uninsured eligibility or uninsured exemption. Now, the problem with the exemption, of course, you probably know, is that they have limited that to only 30-day span per year for somebody who does two 30-day spans per year, correct? For the exemption, no social security number. For Carol.
No. But I mean, it's complicated, but once they qualify, they do get two 90-day spans automatically.
2 90-day spans, okay.
Yes, and then there are circumstances after where they can review with extension and with other clinical,
Yeah, thank you for the correction. 2 90-day spans. I'm sorry about the 30-day. So we do that, and so yes, if they're eligible, we will help them get insurance through Carillon, through those avenues.
Awesome. Thank you again so much, Jennifer and Russell, for your presentation. A lot of really great resources that are out here between you all and Shanita and just what everyone does here with this work group. So I'm always really impressed to hear what's available in the community. It's like a buffet of just services and resources. So it's really great because it's not really a one size fits all type of thing anyway. So it's good to know that there's so many options for people depending on what their needs are. So it's really great to learn this. So thank you so much for taking the time to share with us today. And now I'm going to turn it over to our co-chair, Nina Ward, who is going to briefly introduce our main presenter for today. And then, Lisa, I have your slides embedded in this presentation, so if you need me to advance, just let me know and I can do that for you. Nina?
All right. Thank you, Shanae. Hi, everyone. Happy October, the best season. I love seeing all the hiking and walking in the comments. We have a presentation today from Maryland Wellness, and Lisa Potia Crawley is here with us. And she is in the right place because looking through her background, her passion is in fostering strategic collaborations that strengthen public and behavioral health networks. So Lisa, I think that's exactly what we endeavor to do here at BHAG. Really excited to have you share with us today about Maryland Wellness. A little bit more background about Lisa that's included here. She is a Fulbright and DC Posse scholar. She is as a yoga instructor, a holistic wellness yoga instructor at the intersection of mental, physical, and social health. So again, just a really Kismet presenter for us here at BHAG, and excited to have you. Oh, and I love your inclusion about tending your house plants. I think everybody should do that because it's harder than it seems, but it is very rewarding. So thank you for including that in your background.
Of course, of course. Those are my babies, so there's no way I could make a bio without at least acknowledging that I have about 28 of them. So
I love
it's a
it.
little bit. Thank you guys so much for having me and good afternoon. My name is Lisa Patillo, and I'm the Community Relations Specialist for Maryland Wellness for the Southern Branch. So I'm over the Upper Marlboro and the Waldorf locations. If you can head over to the next slide. We are an outpatient mental health clinic. We service the community through psychiatry, through therapy, and PRP. And we take ages 5 and up in terms of services. So we do the entire lifespan, just to support anyone who's in need of life skills and any emotional support with everything that's happening right now in our social landscape. We're here for you in that way. Next slide. So our approach to everything is we are person-centered. We want everyone to know that you are not your diagnosis. You are not how you're like just what you're feeling right here in this very moment. And we want you to know that there's support out there to bravely cope with with your mental health conditions, or no matter what that is looking like. I've come across a lot of people just being in outreach, and some are just saying they're good and that's it. And I'm like, that's okay to have support even when you're good. Just making sure that it's a safe space for everyone. So even if things are happening and you're not at your baseline the way that you think that you are, that's totally fine. It is a spectrum. So it's safe, it's a safe space, there's no judgment, and you come as you are, which is what I love the most about being here. Next slide. So our mission and values, we provide services to individuals, families, and communities who are needing central life skills and resources through mental health services. And our main goals or our main sayings are we give compassion, transparency, respect, commitment, collaboration, and innovation. And I'd like to circle back to the collaboration and commitment and innovation as we go through the slides, tying and weaving in how we do that. Next slide. So our PRP program, which is psychiatric rehabilitation programming, a lot of people already know what the basics of PRP is, but I'd like to go into a little bit more depth for those who don't know. It is a form of case management for those who are living with mental health conditions and or just released from incarceration. So a lot of people don't know that last bit. If you've been released from incarceration within the past 6 months, then you could also qualify for PRP, so long as you have have Medicaid or pending to receive Medicaid. And that support looks like a lot of things. It helps people with handling big emotions, so stress, anger, anxiety, and just learning those coping skills and mechanisms to be able to create a structure for your day. What does your day-to-day look like? How can I support you with getting to primary care, whether that's transportation or learning small skills like cooking and budgeting. We help with all of those things. Next slide. So we offer individualized and flexible person-centered planning for adults and minors for PRP. And that could look like a lot of different things. So providing access to resources. So we do partner with a lot of organizations and have a really robust resources department that supports with the basic skills. You know, you can't really focus in on your mental health if you're wondering where your next meal is going to come from, or if you're wondering, how am I going to dress myself for my interview and I don't have that resource, right? So we make sure that we give those types of resources to our clients and maintain an individual growth and rehabilitation plan for them while they reach their goals. And we do a lot of collaboration when it comes to the client and making sure that they are the number one in creating their plan. And also with the referring partner, primary care physician, dentist, therapist, whoever the client needs and or wants in their circle of support. Next slide. So child and adolescent PRP, with our PRP program for children, it is from 5 years old and up. They do meet with a rehabilitation counselor about 4 times within a month, and it can be for any mental health diagnosis other than autism. So for example, OCD or ADHD can still count as a mental health diagnosis for PRP support. And we work with the parents to best serve the clients, as of course that's the way that it should go. And I'd also like to add in with this PRP program that we do have groups specifically for PRP. Each of our locations have one group a month, and then we also have therapy groups as well. Next slide. Our therapy currently is CBT and DBT. We provide a very safe environment for individuals to be able to talk about what it is that they need to talk about, right? Um, Making sure that they know that they do matter. And I'd like to point out the client testimonial that we have here. It is a very good program, and the staff are nice and very helpful. They've helped me branch out of my comfort zone. They're always there when I need help or even just a quick check-in. Thanks for helping me find my true self and helping me along my journey. And it's client testimonials like this that actually keep me going and knowing that I actually am making a difference and being able to spread awareness in terms of mental health and what it looks like for everyone. Next slide. Our psychiatry and medication management, I want to really emphasize, because a lot of times when it comes to psychiatry, people think that you're just talking to someone and they're checking off a box and they just give you your prescription and that's it. With our program, we do have board certified psychiatrists and psychiatric nurse practitioners that want to work with you to find the right medication. If we have to go through multiple to figure it out, in different dosages, different times of day, and then actually talk to you about what your symptoms are and what they look like throughout the day, then that's what we will do. It's not a check off the box. And we also understand that you as a person are being affected by the types of medication that we do give. So I really wanted to bring that home for this slide. Next one. So we are now offering targeted case management. And this is the first time that I've actually been able to talk to people about it. And so I'm really excited that we were able to receive a grant for this out in Allegheny County and Garrett County. So basically, we're just making sure that there's more linkages of care to care for our clients and being able to overcome barriers when it comes to access to housing and employment, community resources. We do actually in our resources department have a house case manager, which I'm really excited to be working with as well to make sure that our clients are not only just getting food and clothing, but they have a place to be able to stay as well. Who is eligible? So if you are a Medicaid recipient living in Allegheny or Garrett County, and with a qualifying mental health diagnosis and needing help accessing and coordinating care, then you can definitely do TCM. Next slide, please. the insurances that we accept. So some people have heard the email that I've sent out or seen the email that I've sent out a while back. So currently we are only across the board. We're taking Medicaid, Medicare, and TRICARE for our insurances. In terms of the medication management, we are open to private insurance. So that's Aetna, Cigna, United Healthcare, and Blue Cross Blue Shield. We have changed the way that we have structured our commercial insurances in direct response to what's going on in the world right now and when it comes to Medicaid. So we want to make sure there's already little to no options out there for those with Medicaid. So we want to make sure that we are putting those with Medicaid or uninsured first. And I will give you guys updates as that process is put together and if it changes. And in terms of our sliding scale, we do, if someone is uninsured and unable to pay through or unable to pay through insurance, then we do have a sliding fee scale that is based on your family size as well as the amount of money that you do make yearly. Next slide. This is another client testimonial. Maryland Wellness is very professional and knowledgeable. They were there when I needed help for my father. They set him up with a therapist, medication management immediately. Now he is stabilized and doing better. And that's another thing that I'm also really happy with this organization about is that we don't wait. Normally with our referrals that come in, whether it's self-referred or not, it's between 24 to 48 hours that they receive some type of response. And within a month, with verification of billing, they are at least seen. We're between 3 to 4 weeks. Next slide. Flexible partnerships. So I would like to talk to you guys a little bit about how the ways in which you can interact with us and the ways that we love to partner and be innovative. As I said earlier, we do have a dedicated point of contact in each of our locations. I did not mention this actually, but we're all over Maryland. So I'm just over the southern region, so our Upper Marlboro and our Waldorf. We also have locations in Oakland, Cumberland, Baltimore, Baltimore County, Hartford. We're also in Salisbury as well. And each of these locations have a me. So they have a community relations specialist that you can reach out to be able to facilitate warm handoffs and transitional care coordination. Next is our tailored services. We know that every person is unique, so some things are going to look different, and every organization too is unique. So things are just going to look different, and we're open and all ears to collaborating to how we can make things work best for the client. Coordinated care, similar to what I said earlier. So we just work with you guys to make sure that the client above all is able to thrive, not just survive, but thrive. So one example of what that could look like is, for example, our therapy, right? If someone already comes in and they have a therapist, we don't want you to tear the therapist away. We want for them to be able to do any of the other services that we may have, and they keep the person that they have. So we don't say, oh, you can't do PRP if you have another therapist. We work with that therapist to make sure that that client is receiving the best of care. Our healthcare expertise. So I did mention earlier today that our turnaround for calls are within 24 to 48 hours. I know for a lot of hospitals, readmission is one of the biggest things that you get dinged on a yearly basis. So we want to make sure, A, that once someone is in our care, that they're not going right back to the hospital, that we're stopping them from having crises again, right? So just being able to work with and know what the healthcare landscape looks like is actually one of our specialties. And embedded staff as needed. So I'm available. Anyone else that is that any other community relations specialist, depending on where you are, is also available to be able to sign people up right then and there at your office, as opposed to you having to worry about the background of everything. We can do that for you. Next slide. How we support our clients. So this goes a little bit more into our resources department. We do offer essentials like food, shelter, clothing, and healthcare. So we do take note of primary care physicians and dentists, all sorts of people in the healthcare field that can support our client. And with those shared purposes, we are able to also create community events. So one of the events that I want to bring up is our Harvest of Hope and Warmth. Well, it's more of a drive. So right now we're taking donations for clothing, for shoes, for food, anything that someone would need throughout the winter, coats. To be able to spread within the community and make sure that everyone is supported as things begin to change this fall and into the winter. We also interact with our clients pretty frequently and promote mutual support amongst our community members and staff. Next slide. We do have our social media. This is another way that we tend to help with our partnerships, as well as information about what's going on within the world of Maryland wellness. So some of the things that you can keep an eye on are our monthly newsletter, our weekly email newsletters. We love to spotlight our partners and community events. So if you invite us to a community event, most likely you'll end up on our Facebook, our Instagram, stories, reels, LinkedIn. You'll be featured in some type of way as a thank you for the fact that you've invited us and for the good work that you're doing in the community to make sure that everyone is supported. We also provide mental health tips on all of our social media. That's both for clients and partners as well. Next slide. So how to refer to us. We have multiple ways that you can refer to us. The easiest is to go to mdwellness.org/get started. You can fill this out for someone else, or or that person can self-refer. So that is two options that you can be able to use in terms of referrals. If you are an old school person and would prefer the written pads and fax it in, we can take that as well. And I will coordinate a time to be able to drop that off to you. Just make sure when you say, how did you hear about us? Just put Maryland Wellness Team and then submit. And then one more thing, this QR code that's on this slide and on all of our signage and marketing on the bottom right, you can use to get to the website. So it's multiple ways you can get to us. Next slide. Frequently asked questions. So what skills does Maryland Wellness assist clients with? A little bit of everything. And if we can't do it, then we'll get somebody to do it. So financial management, budgeting, job readiness, whether that's looking like collaborating with the library or other places that or work development spaces, fitness and nutrition, medication education, computer skills, coping skills. That's a huge one for PRP, and socialization. I think I've gone through everything else. And we do offer telehealth services. So if anyone is unable to make it to the 8 locations that we have in Maryland, we can still be able to support them through secure virtual appointments. Next slide. All right, so this is the contact us with all of my information, as well as the Director of Strategic Initiatives, Ms. Dawn Brown, and our Strategic Partnership Specialist, Leanne Roderick. If you're interested in getting in contact with me, please feel free to message me or call me. Either way works. And if you're looking to connect with the organization as a whole, feel free to reach out to Leanne or Dawn. I'd like to end this presentation with saying that we do have an open house that is occurring next week, October 24th. And I'm hoping to see you guys there at 1300 Caraway. And if not, then I'm looking forward to being able to work with you in the future, whether that's events or anything else that you have in mind. Thank you guys so much for having me.
Awesome. Thank you, Lisa. This was a great presentation. And again, another wonderful community resource that's available to Prince George's County residents. I am looking at the time. We have 10 minutes left. Is there one question that we can share with Lisa? And if not, again, her contact information is provided. So you can always follow up with her team directly as well. Hearing none. Thank you. Oh, I see one hand. Alicia?
Yes.
I think you're muted.
Just wanted to confirm the time for the open house.
Yes, so the open house is occurring from 12 to 4. If you're interested in coming, if you could please call or email me so I can fit you into time slots. Our space is not a huge space, so we're making sure that there's staggered attendance for this open house.
Good to know.
Thank you.
Thank you. All right. Thanks again, Lisa. I appreciate it.
Thank you.
All right. So I did want to share, I might have some time for a couple other community announcements, but we have one big update for our community health improvement plan. As many of you have heard me kind of mention previously, we are currently in the process of developing our community health improvement plan, which we call our CHIP. And I don't know why that always makes me think of chocolate chip cookies, and then I want a cookie. It's a whole spiral of thought that goes through my head. But for those who aren't sure or who aren't aware of what a CHIP is, it's essentially just a collaborative, data-driven roadmap that identifies the county's priority health issues and outlines some shared goals and strategies to address them. So we will be leaning on our coalition work groups as key partners throughout this process. And we will be soliciting your feedback as we develop this CHIP. So our next step, our data team will use the upcoming November work group meeting to share some of the key findings related to mental and behavioral health specifically for Prince George's County residents. And we will use next month's meeting to invite your insights, your expertise, and your perspectives to really help us get to the root of why some of these health challenges are happening and explore why they exist in our community. So that will be next month's meeting. So that's November 19th, same time, same place. So I strongly encourage everyone to attend because your feedback is truly important. And then for December, I want to note that there will be no work group meeting in December. However, I am encouraging everyone to attend the quarterly meeting instead on December 9th. So that's Tuesday, December 9th at 6 p.m. And what we will do at that meeting, we'll share some of the preliminary findings from all of the work group discussion. So if you want to join one of the other work groups to partake in that facilitated discussion as well, you're most welcome to. Don't have to just stay within BHAG. But we'll also provide some updates on some changes to the coalition that are going to be happening and facilitate some further discussion and some feedback as a whole group as well. So again, your input at these upcoming meetings is absolutely essential, but that's not just because your perspectives are invaluable, but also because your feedback literally will directly inform the CHIP's priority setting and strategy development. So as we move forward, again, we will be asking for your input many times. So again, just please take note of these dates, and I look forward to seeing everyone then. Carmen, your comment, the date for November's meeting is Wednesday, the 19th at 3 p.m. That's a virtual meeting. All right, I have about 6 minutes to share some community announcements. The December meeting is Tuesday, December 9th. And I'll make sure to send these slides out so you'll have them by tomorrow, as well as some of the community announcements. Okay. So I'm going to just highlight some of our newer community announcements. That's not to say that some of the others aren't important. All of our community initiatives are important. But our MedStar support group, again, they're meeting every Thursday of each month at 11 a.m. So I'll be sure to share all of these resources with you all by tomorrow. Parks and Rec, celebrating Walktober this month, so please celebrate with them. There are a lot of activities, a lot of events for all ages, stages, and abilities to get everybody moving. So check out their website, check the flyer. There are a lot of events happening, so continue to get moving this month. They are also observing Mental Health Awareness Week. That's actually, is it over? That's over. But mental health is important every week. So we will continue to honor that throughout the rest of this month and year as well. Dine, Learn, and Move. So this is a newer announcement. Each month for 90 minutes, there will be free virtual fun to get active and learn tips for making healthy choices. This program is presented to you in partnership with many organizations, but this particular session in October will focus on joint health, and it will take place Wednesday, October 22nd at 6 p.m. Please note that registration is required, so you'll have to email to get yourself registered. The reopening of Hope House that was mentioned in our previous presentation. So they're inviting us all to celebrate their reopening on Thursday, the 23rd at on Main Street in Laurel. Space is limited. So again, please RSVP at the link provided on this slide, or you can also scan the QR code. One Future, One Voice. So in honor of National Substance Abuse Month, Therapeutic Links is hosting this town hall on Saturday, October 25th at 10 a.m. To bring together youth, families, and prevention partners for an interactive day of learning. There's going to be some dialogue, some community connections through informal tables, town hall discussions, some other family-friendly events. So feel free to share this event with your colleagues, with your clients, and with community members alike, and attend as well. Next month on November 1st is the American Heart Association Heart Walk. This will take place at the National Mall, so you can register to join this family-friendly event. You can walk a mile, you can walk 3 miles, you can just come and hang out for some fun, but they are looking for as much support as possible to celebrate this great cause. The health department is hosting their virtual DSMP classes starting November 3rd through December 8th. They're going to meet every Monday online from 4 to 6. So if you or someone you know is living with prediabetes or type 2 diabetes, or you're a caregiver, please consider registering for this free informative class to learn ways to better live with and manage diabetes. We're going to create some action plans and really get some great insight on how to live a healthier life. So registration is required. Again, space is limited. Another new announcement, UMCAP region and University of Maryland Medical System, they're partnering to provide free lung cancer screenings for individuals who meet all the requirements that are listed on this flyer. So that's Saturday, November 8th from 8 to 2 p.m. Appointments are limited and registration is required. So again, scan this code and visit the website that's provided for more information. And then our last announcement, which I have 2 minutes, so I'm doing great. A University of Maryland student is seeking our assistance to study the relationship between personality and health behaviors. So there is a small incentive for your participation. So if you are 18 years or older and you live in Prince George's County, you are eligible to complete this survey. So let's help our future public health professionals in their diligent efforts to make our county a healthier place to live. I have 1 minute. Are there any additional announcements? Thank you for that correction, Lisa. I'll make sure to include that on the slide. Alicia?
Yes, yeah, real quick, it's open house season. So we at QCI are having an open house at our Largo office on November 13th, which is World Kindness Day. So I'm putting the flyer in the chat, and I've also shared it with the organizer of this meeting to share out to the group. So I'm hoping to see you there. It's November 13th from 11 to 3.
Awesome. Thank you.
Thank
And you can
you.
email directly if you have a flyer for that or anything like that you'd like to include. Feel free to email that to me.
Okay, I already did.
Thank you. All right. Well, if nothing else, again, I just want to remind you that our next work group meeting is Wednesday, the 19th at 3 p.m. Again, please, please, please plan to attend, as it will be imperative to gather your insight for our CHIP. So I've made it on time. It's 4:15. I want to honor everyone's time. Thank you so much for everything, for our presenters. I will be sending a follow-up to you all tomorrow by noon, so keep an eye out for that. Thank you all so much. Have a great evening.
Thank you.
Bye.
Have a good evening.
Thank you.
Bye, everyone.
Bye.